But what we find is that for the level 1 autistic patients, the higher functioning, they do much better on the CBD because it helps regulate the anandamide that their body is making, the little bit it's
Mm-hmm.
making. And it also usually it's a full spectrum, so there's still usually a little bit of THC that gets added in. What I find for the level 3 patients, the lower functional patients, what we find is they actually do better on a little bit more THC, because the THC doesn't end up causing a sleepiness or dizziness. It causes it, but it causes the feedback loop in the neurons to work better, as I was mentioning before, that
Mm-hmm.
messaging signal, because that's what anandamide does, is it says, stop sending signals, and that's again what's going to happen in the lower functioning at type 3. But a type 3 ASD patient, or patient with ASD, is very similar to like what I associate it with a type 1 diabetic. They're not really making
Mm-hmm.
any, or if they're making, it's extremely minimal. So you really need to fully replenish it versus just giving kind of like assistance, for lack of better terms.
Mm-hmm.
So it really depends on the patient. The interesting thing about autism is the cannabinoids that are used are not age associated, which I found.
Oh,
So
okay.
I actually have had patients that are in their that have autistic spectrum disorder that are in their,
Mm-hmm.
that are like 18 and 20, that are using a much lower dose than I have patients who are 5 years old or 9 years old using. And it just happens to be with what their endocannabinoid deficiency is and what they can tolerate. Oddly enough, the 9-year-olds can tolerate THC without a problem, even at a half a milligram, yet the 20-year-olds can't tolerate THC at all and has to be on a broad spectrum. So it's just very interesting because, again, you cannot make an assumption that